and 2 rescue breaths. If someone can help you perform CPR, you can swap over every 1 to 2 minutes with minimal interruption to chest compressions. If there's someone there who can help, if they have brought you an AED, ask them to turn it on and follow the instructions while you continue CPR. Continue CPR until emergency help arrives and takes over. The casualty starts to show signs of becoming responsive. They start breathing normally or opening their eyes, or you become too exhausted to continue. If they do start breathing normally, again, place them in the recovery position, monitor them, and prepare to start CPR again if necessary. So remember, if you come across an adult who is unresponsive and not breathing normally, call for help. Ask a caller to call 999 or 112 for emergency help and ask them to bring an AED. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone so that you can begin CPR. Give 30 chest compressions, followed by 2 rescue breaths. Continue giving 30 compressions and 2 rescue breaths until help arrives or they become responsive. If an AED is available, continue CPR while the instructions from the device are followed by your helper. And that's how we perform CPR. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/. If after performing a primary survey, you find a child who is unresponsive and not breathing normally, call for help. Ask someone to phone 999 or 112 and ask them to bring an AED if one is available, while you begin CPR immediately. If you're by yourself and do not have a speakerphone, start CPR with 5 initial rescue breaths, then 30 chest compressions and 2 rescue breaths for 1 minute before calling for help. To give rescue breaths, open the airway by tilting their head back with 1 hand on the forehead and 2 fingers under the chin. Pick out any obstructions from their mouth to clear the airway, only if you can clearly see something. Keeping their head in this position, pinch the soft part of their nose, allow their mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest will rise. Remove your mouth from theirs and watch their chest fall. Give them 5 initial rescue breaths at about 1 breath per second, like this. To do chest compressions, kneel down by the child beside their chest. Place only 1 hand on the center of the chest. Lean over the child with your arms straight and press down vertically 1/3 of its depth. Release the pressure. Allow the chest to come back up without removing your hand from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast, and to help you, you can sing Nelly the Elephant, which can help you to keep up with the pace. After 30 chest compressions, open the airway and give them a further 2 rescue breaths. Continue to alternate between 30 chest compressions and 2 rescue breaths until help arrives. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get a telephone, take the child with you if you are able. Do not leave the child to look for an AED. The emergency services will bring one with them. If there's someone there who can help, if they have brought an AED, ask them to turn it on and follow instructions while you continue CPR. If they can help you perform CPR, you can swap over every 1 to 2 minutes with minimal interruptions to chest compressions. Continue CPR until emergency help arrives and takes over. The child starts to show signs of becoming responsive. They start breathing normally or opening their eyes, or you become too exhausted to continue. If they do start breathing normally again, put them in the recovery position. So remember, if you come across a child that's unresponsive and not breathing normally, call for help. Tell a helper to call 999 or 112 straight away and ask them to bring an AED. Give 5 initial rescue breaths, then 30 chest compressions followed by 2 rescue breaths. Continue giving 30 chest compressions to 2 rescue breaths until help arrives or the child starts to breathe. And that's how we perform CPR on a child. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
If someone sprained an ankle, knee or elbow, you can use a bandage to support the limb. To make sure you give the right kind of support, bend the joint slightly and apply an ice pack and padding, and then a bandage to help cool and support the injury. You need to wrap it either side of the injury too, to give enough support for the whole area. We're going to demonstrate this technique on an ankle, but you could use it for an elbow or a knee. To bandage an ankle, use a roller bandage. Make sure you have the ankle raised and supported to start with, and then apply an ice pack and some padding. Using the roller bandage, start with the tail and put it to the inside of the foot, and then wrap it around 1.5 times just to make sure that it doesn't come off. Just going to lift up your leg a little bit. Okay. It's important to bandage from the toes to the knee because you need to make sure that you cover from the joint before to the joint after the injury site, and then just keep on going around and around. So keep on going until you get to the knee. And then if you can, wrap the bandage around twice when you get to the knee, and then just pin it in place. Does that feel okay? Yep. To check circulation, squeeze the toenail for 5 seconds. When you let go, the colour should return within 2 seconds. If it doesn't, it means the bandage is too tight and you need to loosen it off and reapply it. Keep checking the circulation every 10 minutes because the ankle may still swell. So remember, when you're bandaging a sprain, apply an ice pack and then cover the injury with padding. Apply a roller bandage to hold the ice pack and padding in place and to help support the injury. Check circulation every 10 minutes and keep the injury elevated. And that's how we bandage a sprain. To bandage somebody's hand, use a roller bandage. Place the bandage on the inside of the wrist, just below the thumb. Wrap the bandage straight around the wrist twice. Then wrap the bandage from the inside of their wrist diagonally across the back of their hand up to the nail of their little finger, straight across underneath the fingers and diagonally back across the back of their hand to the outside of their wrist. Pass the bandage under their wrist and repeat, diagonal over the back of the hand, across the fingers and back again. Keep going the same way, bandaging diagonally across the hand like a figure of 8. But each time, only cover about 2/3 of the previous layer. Each new layer should be covering 1/3 of new skin. Make sure you leave the tips of their fingers peeking through. Once you've covered the whole of the hand, wrap the bandage straight around the wrist a couple of times and secure with a pin or tape. To check check the circulation, squeeze the fingernail for 5 seconds. When you let go, if the colour doesn't come back within 2 seconds, it means the bandage is too tight and you need to loosen it a little bit. Keep checking the circulation every 10 minutes. So remember, when applying a hand bandage, use a roller bandage. Make sure the bandage extends far beyond the injury site to ensure an even pressure is applied to the wound.
A heart attack happens when the supply of blood to the heart muscle is suddenly blocked, usually by a blood clot. Lots of people make a full recovery, but there's a serious risk that the heart might stop beating, called a cardiac arrest. It's vital that you help someone who's having a heart attack and call 999 or 112 for emergency help straight away. People who suffer from angina are at increased risk of having a heart attack. Angina is chest pain, often described as a heaviness or a squeezing pain in the chest. The pain should ease within a few minutes if the person rests straight away and takes their angina medication. If the pain does not settle, it is safer to presume it's a heart attack. If you think someone is having a heart attack, they may show some of the following signs. Pain in the chest, which could spread to the jaw, neck, or arms. Breathlessness. Discomfort in the stomach similar to severe indigestion. Collapsing without warning. They may suddenly feel faint or dizzy. They may experience a feeling of impending doom. Pale skin with blueness at the lips. They may have a rapid, weak, or irregular pulse, sweating, or be gasping for air. If you do come across someone with these symptoms, call 999 or 112 immediately and say you think they're having a heart attack. After you've made the call, help move them into a comfortable position to help ease the strain on the heart. The best type of position is sitting on the floor with their head and shoulders supported and their knees bent. Place cushions behind them and under their knees. Then, if you can, and if they're not allergic, give them an aspirin tablet, 300 mg, and tell them to chew it slowly. Aspirin should not be given to someone under the age of 16. If they have angina medication, you can help them to take it. Encourage them to rest. While you wait for help to arrive, monitor their breathing, pulse, and level of response. Try to stay calm to avoid unnecessary stress. If they become more responsive at any time, open the airway, check their breathing, and prepare to treat an unresponsive casualty. You may need to do CPR. So remember, if you think someone is having a heart attack, call 999 or 112 immediately, help move them into a comfortable position, and encourage them to rest. Give them 300 mg of aspirin to chew and help them with their angina medication if they have some. While you wait for help, keep checking their breathing, pulse, and level of response. And that's how we help someone who may be having a heart attack. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/.
Headaches are not usually serious and can be treated at home. Common causes include tiredness, stress, an illness such as flu, or exposure to hot or cold temperatures. But headaches can be a sign of a more serious problem, like meningitis, head injury, or stroke. If someone has other symptoms, or it's following a blow to the head, be sure to seek medical advice. If someone has a headache, help them to lie or sit down in a quiet place and give them something cold to hold against their head. This could be a cold compress, it could be an ice pack, or a bag of frozen peas wrapped up in a cloth. Be sure not to leave it on for longer than 10 minutes. For adults, you can suggest they take the recommended dose of painkillers such as paracetamol. For children, you can give them the recommended dose of paracetamol syrup. If someone has other symptoms such as fever, vomiting, a stiff neck, and sensitivity to light, be sure to seek medical advice immediately. Or if they become unresponsive, call 999 or 112 for emergency help and prepare to treat an unresponsive casualty. If they have a headache following a head injury, if the headache is not settling or their condition is getting worse, they should also seek medical advice immediately. Remember, Get them to lie or sit in a quiet place. Help them to take the recommended dose of painkiller. And if you are concerned, seek medical advice. That's how we treat a headache.
If you think someone has had a head injury, there are 6 key things you may find. They may have become unresponsive, even for a short time. There may be a scalp wound. They may complain of dizziness or nausea. They may have memory loss of events at the time of the injury or before the injury occurred. They may complain of a headache. They may be confused. If you're worried about someone who has had a head injury, you should get medical advice. With someone who has had a severe head injury, you may find that they have had a severe blow to the head, unresponsiveness or a deteriorating level of response, leakage of blood or watery fluid from the ear or nose, unequal pupil size. If a casualty has any of the signs of a severe head injury, seek emergency medical help. To treat someone with a minor head injury, sit them down and give them something cold to hold against the injury, like an ice pack or frozen vegetables wrapped in a cloth. Amy, can you just put the injury? Thank you so much. Assess the level of response using the AVPU scale. Ask yourself, A, is the casualty alert? Are the eyes open? Do they respond appropriately to commands? V, does the casualty respond to your voice? Can she answer simple questions? P, does the casualty only respond to pain? If you pinch the earlobe, do they open their eyes? U, are they unresponsive to any of the above? If they can respond normally, the head injury is probably minor. Keep monitoring their level of response, breathing, and watch for any changes. Treat any scalp wounds like a bleed by applying direct pressure to the wound. When the casualty has recovered, ask a responsible person to monitor and look after them. If a casualty has sustained an injury to the head whilst playing sports, do not allow them to return to the sport until they have been fully assessed by a medical practitioner. Advise them to seek medical advice if their condition gets worse, they're over 65, they've had previous brain surgery, they're taking anti-clotting medication, they've been drinking or taking drugs, or if there's no responsible person to look after them. If you check their level of response and they're not alert, and so you think that they've had a severe head injury, call 999 or 112 for emergency help and tell them that you suspect a head injury. If you can, use a speakerphone so that you can continue to treat the casualty whilst making the call for help. If they're unresponsive but breathing normally, following a head injury, open the airway in the position that they were found, just in case they have sustained a spinal injury as well. This is to reduce further movements to the neck. Call 999 or 112 for emergency help. Continue to monitor the levels of response while waiting for help to arrive. If you think someone with a minor head injury is getting worse, they may show these signs: increased drowsiness, persistent headache, confusion, dizziness, difficulty walking, difficulty speaking, vomiting, double vision, seizures. If you're concerned, call 999 or 112 for emergency help and monitor their level of response. So remember, when treating a minor head injury, sit them down, treat any scalp wounds, and check their level of response. If they have a severe head injury, call 999 or 112 for emergency help. And that's how we treat someone with a head injury. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
Kenyatta University Teaching Referral and Research Hospital is a modern tertiary health facility with state-of-the-art services that ensure delivery of cutting-edge healthcare and medical research in Kenya and the region. Located on a 100-acre piece of land in Nairobi County, Kenya, the Kenyatta University Teaching Referral and Research Hospital is a Level 6 hospital with a bed capacity of 650. It is easily accessible by public means, private vehicles, and has a helipad to enhance accessibility, especially in an emergency.
KUTRH is a highly specialized Level 6 referral hospital. And our flagship project is oncology, cancer care. But we also offer other highly specialized services, including cardiology, renal, and we also have specialized services in clinical care, ranging from orthopedics to surgery to all the other services within the clinical care.
Kenyatta University Teaching Referral and Research Hospital is a world-class healthcare facility, a concept largely attributed to Professor Olive Mugenda and financed through a government-to-government loan from China. The hospital was officially opened in September 2020 and has continued to make tremendous contribution in support of provision of specialized health services.
We are now almost 4 years old since we started. And we have about inpatient population of about 360 patients and many more patients who come every day as outpatient. We are a purely referral hospital, which means we don't accept walk-in patients. They must be referred by doctors from other hospitals, with an exception of accident and emergency where those patients, we are able to see them, of course, as they come.
Living up to its founder's vision, the facility has reduced the need for Kenyans to travel abroad for medical care, while also increasing medical tourism from other African countries in the region. It is overseen by a dedicated and experienced team of doctors who are supported by a professional cadre of nursing and paramedic staff. Kenyatta University Teaching Referral and Research Hospital is equipped with modern and sophisticated clinical and surgical equipment that provide comprehensive care for all aspects of health, from prevention to diagnosis, treatment and rehabilitation.
For us as a hospital, our vision is to stop medical tourism, especially the outward medical tourism, and we are deliberately looking at issues that take people away to other countries. We have dealt with the PET scan, and I can confidently say that the number of people who are going outside the country to get the PET scan treatment have reduced drastically. Now we have gotten CyberKnife, and as we get support from the government, we'll continue looking at the areas that make people go away.
Key services include accident and emergency services, diagnostic imaging services, surgery, pathology and lab medicine, physiotherapy and rehabilitative services, maternity services, specialized clinics, cath lab, oncology center including chemotherapy, radiotherapy and brachytherapy, renal unit, critical care services, wellness services, integrated molecular imaging services including PET, CT and SPECT, CT services and CyberKnife.
What we've done as government is that we have cascaded the issue of early testing to the county level. And that earlier testing from the county level will involve centers that we've developed. At the moment, we've developed around 4 cancer centers, regional centers, where we expect that patients would be able to be referred through the actual referral mechanism that we've come up with in the new thinking. And therefore, then they can be able to be diagnosed and be made, treated at that level. So this cyber knife that is going to be launched on Monday by His Excellency the President is speaking to the thinking that we need and we have as government developed specialized treatment for non-communicable diseases.
Kenyatta University Teaching Referral and Research Hospital has a hospitality center providing quality accommodation spaces for patients and caregivers, especially those traveling from far distances within the country as well as those seeking services from other countries. The hospitality center also features a restaurant and a fully equipped gym. The hospital's flagship project is oncology. Because of the specialized nature of the treatment, the facility is purely of a referral nature, with patients being referred from other hospitals.
Cancer National Institute, that is the one that is helping us to put all stakeholders in place. Number one, to create awareness in terms of what cancer is and what Kenyans need to do to be able to manage cancer. National Cancer Institute, together with our program heads here, then they have gone ahead to derive and prepare policies, guidelines and directives on how then we go about diagnostic. So for us to be able to know who has cancer and at what level of cancer. The same institute, together with our program here, then they have developed mechanisms in terms of how do we treat. So we have chemotherapy, we have radiotherapy, surgery, and now this, the very high level that we are going to, that is being installed at, commissioned at the Kenyatta University Teaching and Referral Hospital. But also important for Kenyans to know that those who are registered on NHIF, they can access cancer treatment, including this cyber knife that is being commissioned by Kenyatta University Teaching and Referral Hospital.
One of the cancer treatment services now available at Kenyatta University Teaching Referral and Research Hospital is cyber knife treatment. This is a painless and non-invasive treatment for cancerous and non-cancerous tumors. The cyber knife delivers precise pulses of high-dose radiation that target certain tumors and other abnormal tissues while limiting exposure to surrounding healthy tissues.
Contrary to what the name suggests, cyber knife is actually not a knife, but rather an advanced radiotherapy machine that delivers very high doses of radiation with sub-millimeter accuracy.
With the cyber knife, doctors are able to reach areas of the body that were previously thought untreatable, such as head and neck cancers and brain tumors, with a sub-millimeter accuracy. The precision of the treatment limits damage to healthy tissues, reducing side effects. Another benefit of this treatment method is the almost immediate recovery. These benefits make cyberknife treatment ideal for patients who are unable to or prefer not to undergo conventional surgery.
We needed to get an equipment which can provide precision treatment, and that is why we started thinking, okay, we now can diagnose cancer at very early stages, but what do we do about those patients who need treatment? And we needed now to think of then, completing that continuum from diagnostics to treatment. And then we started looking for one machine which can, complement what we have, but very specialized so that people don't have to go outside the country to seek this particular service. Some of the conditions that can be treated using cyberknife mainly is both cancerous tumors and non-cancerous tumors. This machine is the second one in Africa after Egypt.
First, allow me to congratulate the leadership, starting with the chair of the board, Professor Olive Mugenda, together with the CEO, Dr. Dagane, for this milestone that they're achieving in terms of being able to commission cyberknife. As you are well aware that on the continuum of care of cancer, WHO has played cyberknife as the best, actually the topmost, in terms of precision, in terms of dealing with the surgeries, dealing with cancer cases.
Kenyatta University Teaching Referral and Research Hospital is led by a board of directors as well as a management team responsible for the management and administration. The hospital's directorates are clinical services, nursing services, administration and corporate services, planning development and partnerships, training, human resource development, Integrated Molecular Imaging Center and Research and Innovations.
It's really good for us to have this sort of specialized machine here because it's, first of all, it's non-invasive. It means that it is very safe and effective for treating cancers. And of course, we are excited for us to have this kind of treatment here because Kenyans, it means Kenyans now will no longer be going to India or other countries seeking those services.
Our vision remains to be a premier national referral hospital renowned for clinical excellence, medical training and research that enhances quality of lives for Kenyans and the regional citizens, with the mission to enhance quality of lives through provision of quality patient-centered and evidence-based healthcare training innovation and state-of-the-art technology. Kenyatta University Teaching, Referral and Research Hospital services are carefully priced to ensure that they are affordable to Kenyans, while at the same time ensuring sustainable operationalization of the facility.
stuck in small spaces. Sometimes they may get hand or finger injuries such as bruises, cuts or fractures, or they may hurt or sprain their arm or wrist. In the following steps we'll cover hand and finger injuries, then we'll cover forearm and wrist injuries. If your baby has trapped their hands or fingers, these are the things to look for. They may find it hard to move their hand or wrist. They may feel pain in the area. The hand or wrist may be tender and there may be swelling or bruising. If you think your baby has a hand or finger injury, take the following steps. Sit or lie your baby down and try to raise and support the affected wrist and hand. If there is any bleeding, run the cut under cold water first, then loosely cover the wound with a new sterile dressing or large, clean, non-fluffy pad. Call your doctor or see a nurse, especially if your baby's fingernail has been injured or you think there may be a fracture, a broken bone. If your baby's in a lot of pain, you can try treating them with the recommended dose of paracetamol. Now we're going to move on to wrist and forearm injuries. If your baby has injured their wrist or forearm, these are the things to look for. The area may be tender, and there may be swelling or bruising, and they may feel pain in the area. It can be difficult to know if your baby has a sprain or a fracture, but if you think your baby has a wrist or forearm injury, take the following steps. Remember, RICE. Rest. Help your baby to sit or lie down and support their arm in a comfortable raised position. ICE. Apply something as cold as your baby can bear. This could be a cold flannel, an ice pack, or frozen peas wrapped in a cloth. Leave the ice pack in place for no longer than 10 minutes. Comfortable support. You could wrap a soft layer of padding, like cotton wool, around the area. And elevation. Keep your baby's arm raised with something soft, like cushions or a rolled up blanket. Call your doctor or see a nurse if your baby is in severe pain or they can't use their hand or wrist at all. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. So remember, for hand or finger injuries, sit or lie your baby down and raise the injured hand. Wash any cuts and cover the wound with a non-fluffy dressing. Pad the hand with something soft. Call your doctor if you have any concerns. For severe pain, you could give the recommended dose of paracetamol. For wrist and forearm injuries, remember RICE. Sit or lie your baby down and raise the injured arm. Apply ICE. Support the arm and keep the arm raised. Again, call your doctors if you have any concerns. For severe pain, you can give the recommended dose of paracetamol. And that's how you treat a baby who has hurt their hands or their arms. Thanks for watching. Help support St John Ambulance.
People may faint as a reaction to pain, exhaustion, hunger, or emotional stress. It may also happen after someone has been standing or sitting still for a long period of time, especially if they are hot. When someone faints, their pulse slows right down, but it usually picks up again quickly and goes back to normal. If someone has fainted but doesn't come round after a couple of minutes, then this could be more serious. There are 3 key signs of someone who has fainted. They have a brief period of unresponsiveness, causing them to fall to the ground. They may have a slow pulse. Their skin may be pale, cold, and sweaty. If someone's feeling faint, advise them to lie down. Kneel down next to them and raise their legs, supporting their ankles on your shoulder or a chair if available, to help blood flow back to the brain. Watch their face for signs that they are recovering. Make sure that they have plenty of fresh air. Ask bystanders to move away, and if you're inside, ask someone to open a window. They should recover within a couple of minutes. As they recover, reassure them and help them to sit up slowly when they are feeling better. If they don't become responsive again, quickly open their airway, check their breathing, and prepare to treat someone who is unresponsive. So remember, if someone's feeling faint, lie them down and raise their legs. Make sure they have plenty of fresh air, and when they recover and are feeling better, help them to sit up slowly. If they remain unresponsive, prepare to treat an unresponsive casualty. And that's how we help someone who's feeling faint or have fainted. If this video has been helpful to you, help support St John Ambulance by going to sjaa.org.uk/donate. When there's something wrong with your baby, if you know what to do, you'll give them the best chance of survival. If something has happened to your baby, you'll need to do a primary survey. This is a quick, orderly way for you to find out if your baby has any injuries or conditions that are life-threatening. You should always perform a primary survey before treating your baby because it will help you find out what's wrong and the best way to help them. We can use the initials DRABC or Dr. ABC to remind us of the steps we need to follow. These initials stand for danger, response, airway, breathing, and circulation. To perform a primary survey, first you need to ensure there's no danger. That means nothing near the baby that may cause further harm to them or to you. This is to avoid any injury to you and to prevent you from becoming a casualty as well. Look around quickly and make sure it's safe to approach. If you see any danger or anything hazardous nearby, clear it away quickly. Try to see if your baby responds to you by gently tapping or flicking the sole of their foot and call their name. They are unresponsive if they don't respond to you. Martha, can you hear me? Next, you will need to check if they are breathing. To check for normal breathing, open the airway. Place one hand on your baby's forehead and very gently tilt their head back. With one finger, gently lift the chin to open the airway and check to see if they're breathing. If your baby is not breathing normally, ask a helper to call 999 or 112 for emergency help. If you're on your own, use a mobile on speakerphone so that you can start CPR as soon as possible. If you don't have a speakerphone, begin CPR for 1 minute before making the call yourself. If your baby is breathing normally, check to see if they are bleeding. This will enable you to stop blood loss from the circulation. Try to treat and control any severe bleeding. If your baby is not bleeding severely, place your baby in the recovery position. Just cradle the baby towards you in your arms with their head tilted downwards. This will help keep your baby's airway clear and prevent them from inhaling any vomit. Keep monitoring their breathing until help arrives. If they stop breathing, open their airway and start CPR. So remember, do a primary survey to try and find out what's wrong as quickly as possible. We do this by checking for danger, check for a response, open their airway and check their breathing. If they aren't breathing, call for help, ask a helper to dial 999 or 112 for emergency help and begin CPR. If you're on your own, use a speakerphone and start CPR as soon as possible. If you don't have a speakerphone, do CPR for a minute before calling for emergency help. If they are breathing normally, check their circulation, check for severe bleeding and treat if necessary. If there is no severe bleeding, hold them in the recovery position until help arrives. If they stop breathing, open their airway and begin CPR. And that's how you perform primary survey on a baby.
In young children,
Thanks for
seizure,
watching.
also
Help
known as
support
a convulsion
syndrome
or fit, can be caused by raised body temperature linked to throat, ear or other infections. It can occur because the brain is not mature enough to deal with the body's high temperature. When a child is having a seizure, you may find they have loss of or impaired response, vigorous shaking with clenched fists and an arched back, signs of a fever with hot, flushed skin and sweating, breath holding and red, puffy face, possible vomiting, or a loss of bowel or bladder control. If you think your child is having a seizure, place pillows or soft padding around the child so they don't injure themselves on surrounding objects. Do not restrain them. If they have a raised body temperature, try and cool the child by removing any bedding and clothing, although you may have to wait until the seizure stops to do this. Ensure there is fresh air, but make sure the child doesn't get too cold. When the seizure has stopped, open the airway and check their breathing. If they are breathing, put the child in the recovery position, call 999 or 112 for emergency help. While you wait for help, reassure the child and monitor their level of response. So remember, place padding around the child and don't restrain them. Try and cool them down. When the seizure has stopped, open their airway and check their breathing. If they are breathing, put them in the recovery position and call 999 or 112 for emergency help. And that's how you help a child having a seizure. If this video has been helpful to you, help support St John Ambulance by going to
shaa.org.uk/donate.
The new Kenyatta University Teaching, Referral and Research Hospital is the boldest, most sophisticated health facility initiative ever undertaken in Kiambu County and Kenya. A project that has created a global health center that ensures Kenya and the region has world-class facilities that cut across the entire health arena to serve generations and contribute significantly to the Kenya Big Four agenda, specifically universal healthcare for all and the global sustainable development goals.
The President has made a commitment that this becomes a center for excellence, particularly for oncology in this country.
Kenyatta University Teaching, Referral and Research Hospital is a 650-bed capacity hospital with state-of-the-art medical equipment.
Kenyatta University Teaching, Referral and Research Hospital is a level 6 hospital. We will be offering specialized care. We will be expecting patients to be referred to us from other levels of care. So we'll expect patients from level 5 hospitals to be referred to us, those who require specialized attention.
The hospital is located on a 100-acre piece of land that lies in the northwestern part of Kenyatta University, bordering Kahawa Barracks to the south and the Northern Bypass Road to the east. The main entrance to the hospital is on the Northern Bypass Road near Kahawa West. It is easily accessible from main roads and public transport services. The hospital also has a helipad, a landing strip to enhance access. Following the preparatory phase of design and preparation jointly carried out by China Jiangxi Corporation and Kenyatta University, groundbreaking was undertaken in 2011 with the objective of providing a world-class healthcare in Kenya and the region. Kenyatta University Teaching, Referral and Research Hospital was the brainchild of Professor Olive Mugenda, who initiated the preparation of the proposal and leading her team from Kenyatta University in making a case for the hospital through the then Minister for Finance, who is now the current President, President Uhuru Kenyatta. The government approved a government-to-government loan from China Exim Bank for construction and equipping the hospital. The hospital was constructed and equipped at a cost of 8 billion Kenya shillings.
I'm happy that the vision we had 10 years ago has now been accomplished, and now we have patients accessing our services in this hospital.
It was the founder's vision to establish a world-class healthcare facility which will reduce to the barest minimum traveling out of Kenya for medical care abroad and at the same time attract medical tourism from other countries in Africa. Our vision is to be a premier national referral hospital renowned for clinical excellence, medical training and research that enhances quality of lives for Kenyans and the regional citizens. Our mission is to enhance quality of lives through provision of quality, patient-centered and evidence-based healthcare, training, innovation and state-of-the-art technology. Built and benchmarked with international standards to provide world-class healthcare. It is headed by a team of dedicated, experienced and qualified doctors supported by a professional cadre of trained nurses and paramedic staff. KUTRRH houses advanced and sophisticated clinical and surgical facilities, providing comprehensive care to address all aspects of health, from prevention to diagnostic and treatment to rehabilitation.
Even though we have many specialized areas in this hospital, our flagship project is a cancer, or what we are calling oncology center. And this center has 74 beds, and already we have started admitting patients. But I must also add that it's going to be a purely referral hospital. So our patients are being referred from other hospitals because of the specialized nature of the treatment.
Deliberately and carefully built in the fabric of KUTRRH is quality. The KUTRRH Board of Directors is responsible for the management and administration of the hospital.
I would like to thank the board members who are behind here, who have been working very hard, hiring the right staff here. As the CS said, we have the doctors, we have the nurses, we have other staff members who will be working with us.
The major directorates of the hospital are clinical services, nursing services, corporate services and administration, finance strategy and planning, training, research and innovations. The highly sophisticated medical center shall offer quality medical care with the following units: ICU, HDU, KUTRRH has the highest ICU and HDU bed capacity among the healthcare establishments in Kenya. There are 24 ICU beds and 10 HDU.
The beds are fully equipped with world-class bedsides where there is panels of sockets where we use to ventilate the patients. It has world-class machines for infusion of medications and drugs. They should expect quality health care, and we are ready to provide that care. We have qualified nurses and doctors on board, and all the nurses here are critical care nurses.
The burden of cancer is rising within our nation, and therefore KU is well placed in handling all matters regarding cancer. We'll be dealing with initially diagnosis and treatment of cancer. Treatment will involve having a radiotherapy machine, which is the most modern, called the linear accelerator, and we'll also be giving chemotherapy for patients who have cancer.
Every unit is equipped to treat every type of procedure, including trauma surgeries. Medicare is further supported by the availability of telemedicine to enable doctors to consult with peers worldwide on real time, thus reducing the need to seek treatment abroad. The ultra-modern laboratories are equally proficient to delivering high standards of services.
And we have the best equipment that you can find in any part of the world, like Europe and USA. And that means that you are able to diagnose the most complicated diseases without sending samples outside the country. And it also means that we are able to give the best teaching and practical approach as far as the students are concerned.
The hospital strives to extend world-class preventive, curative and holistic care to individuals from every level in the society in a safe, ethical and affordable manner with world-class infrastructure facilities that include outpatients, accident and emergency, pharmacy and diagnostic imaging.
The drugs we have are of good quality. We source them from Kenya Medical Supplies Agency, that's KEMSA. We have all sorts of drugs. Our core focus is drugs for cancer. We have drugs for dialysis, that is when you want to clean the system when a patient has renal failure. We have drugs for accident and emergency. Those are patients who present to the casualty with more or less emergency kind of conditions. We also have drugs for theaters, where those are used for in the event a patient goes under general anesthesia, so that the surgeons can perform what they need to perform, basically the operations.
Inpatient services, pathology and lab medicine, based and specialized, critical care, medical and surgical, specialized internal medicine, that is oncology, renal and neurology, diagnostic imaging, obstetrics and gynecology services. Kenyatta University Teaching, Referral and Research Hospital believes healing begins as soon as you arrive at the hospital. At the core of our new design, the idea of personalizing and humanizing the healthcare experience will be apparent at the hospital. Furthermore, the hospital premises provides a green, relaxed and soothing environment for healing and visits. Given the advanced facilities the hospital presently has, combined with the human resources being assembled to undertake medical care, research and training, we hope to meet the expectations of Kenyans in the provision of quality healthcare.
Privileged to have met one of the best doctors, in terms of matters oncology, matters nephrology, trauma management. We have them here.
The numerous conference halls, equipped with teleconferencing facilities, will enhance continuous medical education. It is expected that the hospital will provide the necessary environment and incentives for the conduct of biomedical research and clinical trials in order for our medical scientists to contribute to improved medical care and production of new pharmaceuticals.
Our hospital has three main pillars. The first one is on services, where we would be expecting patients to be referred to us. The second one is on training, teaching. So in the near future, we'll expect to start undergraduate and postgraduate programs together with other trainings so that we can build on the numbers of trained human resource in health. This will go a long way in us achieving the universal health coverage. Our other mandate is on research, and we have already set foundations, very strong foundations, where we'll be able to do a lot of basic research, applied research, and also conduct clinical trials.
The support services which complement medical care in the hospital are doctor's plaza, staff quarters, academic block, laundry and catering services, restaurants, helipad, banks, among others.
If you look at the infrastructure around this hospital and you look at the keen interest that the government has, if you look at the keen interest that our Cabinet Secretary of Health has in this hospital, and if you look at the need in the market, in the region, and even in the locality for this hospital, it's very, very clear that if we get our act right, this is going to be a hospital that is a game changer in the region.
The new Kenyatta Hospital Funeral Home is opened to the public.
We are also thinking of acquiring the first integrated molecular imaging center, and this is a center which will help minimize the number of people who seek cancer treatment and diagnosis outside the country, because the center will have the modern machines that are required to do that. So I must thank the government through the Ministry of Health because they are very committed to ensuring that the resources are available to start this center, and it will be the first center, public center in East and Central Africa, and it will really go a long way in helping Kenyans access the necessary treatment.
Given the advanced facilities the hospital presently has, combined with the human resources being assembled to undertake medical care, research and training, we hope to meet the expectations of Kenyans in the provision of quality healthcare.
I wish to inform you that Kenyatta University Teaching, Referral and Research Hospital is now open.
objective of providing a world-class healthcare in Kenya and the region. Kenyatta University Teaching, Referral and Research Hospital was the brainchild of Professor Olive Mugenda, who initiated the preparation of the proposal and leading her team from Kenyatta University in making a case for the hospital through the Minister for Finance, who is now the current president, President Uhuru Kenyatta. The government approved a government-to-government loan from China Exim Bank for construction and equipping of the hospital. The hospital was constructed and equipped at a cost of 8 billion Kenya shillings.
I'm very delighted to see a vision that we started 10 years ago being actualized and saving lives, particularly at this time of COVID-19 pandemic.
It was the founder's vision to establish a world-class healthcare facility which will reduce to the barest minimum traveling out of Kenya for medical care abroad and at the same time attract medical tourism from other countries in Africa. Our vision is to be a premier national referral hospital renowned for clinical excellence, medical training and research that enhances quality of lives for Kenyans and the regional citizens. Our mission is to enhance quality of lives through provision of quality, patient-centered and evidence-based healthcare, training, innovation and state-of-the-art technology. Built and benchmarked with international standards to provide world-class healthcare. It is headed by a team of dedicated, experienced and qualified doctors supported by a professional cadre of trained nurses and paramedic staff. KUTRRH houses advanced and sophisticated clinical and surgical facilities, providing comprehensive care to address all aspects of health, from prevention to diagnostic and treatment to rehabilitation. Deliberately and carefully built in the fabric of KUTRRH is quality. The KUTRRH Board of Directors is responsible for the management and administration of the hospital. The major directorates of the hospital are Clinical Services, Nursing Services, Corporate Services and Administration, Finance Strategy and Planning, Training, Research and Innovations. At KUTRRH, we believe quality is never an accident but a premeditated effort. The hospital is among few in the region to function with full-time doctors system that assures doctors' availability around the clock, giving dedicated time and attention to patients.
We mainly deal with offering clinical services and ensuring that all patients are treated accordingly. My division is very wide and it encompasses a lot of various disciplines, majorly of which is oncology services, accident and emergency, trauma and orthopedics, where we are able to perform surgeries. We have a fully established pharmacy which is able to provide nearly all kinds of drugs. In terms of laboratory, the whole pathology area, we have a well-equipped laboratory. We are able to do state-of-the-art tests.
The highly sophisticated medical center shall offer quality medical care within the following units: outpatients, accidents and emergency, pharmacy and diagnostic imaging, inpatient services, pathology and lab medicine, critical care, medical and surgical, special internal medicine, oncology, renal and neurology, obstetrics and gynecological services.
As a hospital, and more specifically as a pharmacy department, we pride ourselves with offering high quality services because, as I mentioned, our staff are very highly qualified. Then number two, our drugs are of assured quality because of the kind of sourcing that we go through just to bring them to the hospital.
Critical care, medical and surgical. ICU HDU, KUTRRH has the highest ICU and HDU bed capacity among healthcare establishments in Kenya. There are 54 ICU beds and 10 HDU.
The beds are fully equipped with world-class bedsides, where there is panels of sockets where we use to ventilate the patients. It has world-class machines for infusion of medications and drugs.
The Department of Anesthesia and Critical Care, we provide services in all these departments, especially theatre and the intensive care unit.
Oncology Cancer Unit. The ultra-modern oncology unit is a beacon of hope, health and happiness.
Our flagship project is Oncology Center, where we are dealing with cases of cancer. And we are undertaking very good services in radiotherapy and also radiology treatment with great outcomes.
The team of oncology specialists work together to develop individualized treatment plan for every patient with great results.
This team consists of the oncologists, the surgeons, the palliative nurses, our nutritionists, physiotherapy, the pathologist, and our oncology nurses. And once a week we have this meeting, the multidisciplinary team meeting, where we discuss the management of all the patients who were seen in the previous week, so that we can make the treatment of every patient a focused and patient-centered treatment to target the specific needs of every patient.
We offer cancer care services across surgical, radiation, and medical oncology. Every unit is equipped to treat every type of procedure, including trauma and surgeries. The ultra-modern laboratories are equally proficient to delivering high standards of services.
And we have the best equipment that you can find in any part of the world, like Europe and USA. And that means that you are able to diagnose the most complicated diseases without sending samples outside the country. And it also means that we are able to give the best teaching and practical approach as far as the students are concerned.
The numerous conference halls equipped with teleconferencing facilities will enhance continuous medical education. Embracing new technologies to offer high-level healthcare that matches the best globally. Medicare is further supported by the availability of telemedicine to enable doctors consult with peers worldwide on real time, thus reducing the need to seek treatment abroad. It is expected that the hospital will provide the necessary environment and incentives for the conduct of biomedical research and clinical trials in order for our medical scientists to contribute to improved medical care and production of new pharmaceuticals. Kenyatta University Teaching, Referral and Research Hospital believes